Hi, Miss Kendall. My name's Sydney. I'm the student nurse today. I'm going to be taking care of you. Can you go ahead and tell me your name and date of birth? All right, perfect. We're going to get started off. I'm just going to check some vitals on you real quick, if that's okay with you. I'm going to go ahead and get a pulse. Okay, pulse is 72. Perfect. I'm going to go ahead and get a blood pressure. Okay, 125/72. Also normal. Okay, I'm going to go ahead and get temperature axillary. Okay, 98.2 Fahrenheit. Again, that's normal. Resp's about 18 as well. Okay, just right. And if that's okay with you, I'm going to go ahead and listen to your heart tones and your breath. Just go ahead and breathe normal. Okay, while I'm here, I'm just going to go ahead and listen to your bowel sounds if that's okay. Okay, bowel sounds are completely active, which is great, especially after everything. When was the last time you were able to go to the bathroom? Last time you had a bowel movement or voided? Okay, perfect. Was there any pain with urination, any bleeding, any discoloration? All right, awesome. Okay. I'm gonna roll this up, and I'm gonna go ahead and I'm gonna wash my hands. I'm gonna put new gloves on. Put new gloves on. I'm gonna roll this down, and I'm just gonna take a look at your uterus right here and your fundus. If that's okay. Use two hands. Feel the fundus up here. Okay. And we are about 2 fingers below the umbilicus. Is firm. It's midline. Okay, everything's about the way it should be. If it's all right with you, I'm gonna go ahead and take a look at your pad. How long have you had this one on? Okay, perfect. So the color, it's about rubra, which is normal, considering it's mild to moderate. It's normal considering she's had it on for less than an hour. Odor is very, very minimal, very normal, which is great. Go ahead and roll this down. Any pain in your calves or legs or feet? Just gonna check for swelling. Okay, it doesn't hurt whenever I do this. Okay, great. All right, I'm gonna come up here. If it's okay with you, I'm just gonna palpate your breasts. I'm gonna feel for any tenderness or any abnormalities. Does it hurt whenever I push on it? Okay. And the breasts, they're not tender, they're soft, and the nipples, they're not cracked, they're no drainage, everything is normal. Great, we love it. If it's okay with you, I'm gonna have you roll. Okay, I'm gonna go ahead and take a look at your site where you got your epidural. I'm gonna peel back the bandage. Drainage site is clean and normal. I would check for redness, edema, ecchymosis, any drainage, and the other one, the A, whatever that means. Okay, and if it's okay with you, I'm just gonna peel this back. I'm just gonna check for any hemorrhoids. Okay, everything's normal. Okay, go ahead and roll on your back for me. Okay. Straighten this out. Okay. Now, if this patient were to have a cesarean, I would check the site. Let's be right here. I would check for any drainage, any abnormalities. I would make sure the bandage is clean and dry as well. I would also check her Foley catheter, make sure everything is the way it should be, no signs of infection, and drain her Foley bag. as well. IV site is on the left radial. It flushes well. There's no sign of any redness or swelling. So we do love that. Everything seems to be good. Make sure I went over everything. I think so. I'm gonna just go ahead and educate you on a couple things, just some things to go home with, to think about. Make sure you're staying hydrated. Minimum of 10 glasses of water a day. It's extremely important to make sure you're staying hydrated after everything you've been through, as well as eating. Make sure you're getting at least 2,300 to 2,500 calories per day, if not more. A lot of that including fiber, so that you're moving your bowels through and not getting any constipation. Make sure you're getting up and moving around a lot. We want to prevent DVTs and blood clots as much as we can. And getting up and moving around, that'll help regain some strength. That'll help with your bowels. It'll help with a lot of things. So as soon as you have the strength, try to go ahead and start doing that. If you have any sort of tenderness on your nipples or in your perineal area, you can try medicated pads on either one of them. A little DIY that I've been told is cabbage leaves on the breasts as well. Will relieve some pain. And just try to go ahead and refrain from any intercourse for 4 to 6 weeks or until your body's completely healed. We don't want to cause any unnecessary ripping or bleeding or any sort of trauma. So other than that, how are you feeling emotionally after everything that you've been through? How are you feeling? You should definitely feel a sense of relief though for going through everything, and if you ever need anything, we're all here. We're all here for you, and if you need anything at all, just let us know.